The novel coronavirus pandemic has prompted lots of questions and uncertainty this year. How is the virus transmitted? Am I at risk? What is safe to do? But in addition to those immediate concerns, this pandemic is changing our lives forever in ways we are only now starting to grasp. I'm Nadia Hamdan from KUT 90.5, Austin's NPR station, and this is Now What, a series of live-streamed events from KUT in partnership with the University of Texas at Austin and Dell Medical School, focusing on what comes next as we deal with what the coronavirus means for our lives now and in the future. Each week, we're talking with scientists, researchers, and thinkers from across UT Austin to get the latest about COVID-19. This week, we're talking with Lauren Ancel Meyers. She's a mathematical epidemiologist and a professor of integrative biology at UT Austin. She also runs the UT COVID-19 Modeling Consortium and works with public health agencies around the country to develop models that forecast, track, and hopefully help slow the spread of the novel coronavirus. If you have questions during our discussion, write it in the comments on Facebook, and we'll try to get to as many of them as we can. Lauren, thank you for being here.
Nice to be here.
All right, so I'm going to jump in with the first question here. What do the most recent models say about the spread of COVID-19 in Central Texas? Have we peaked? And if not, when might the peak come?
Sorry, I'm hearing a little bit of background noise, but I think you asked me about where are we in Central Texas with respect to the first wave of the pandemic, and we are looking at on a daily basis at data for the entire 5-county Austin at Round Rock MSA, and what we see is that when the pandemic started spreading in Austin, cases started rising, hospitalization started rising, we started seeing a few deaths. And they sort of got to this high point and they've stayed there. We haven't seen hospitalizations or cases or deaths start to subside. And in fact, with the relaxation of social distancing measures, we wouldn't expect that to happen at this point. And what we're hoping is that people are taking precautions when they're going out in public, they're wearing face masks, they're keeping their distance, so that what we don't see in the coming weeks and months is a large second wave or a surge in cases and hospitalizations.
And can you talk to me a little bit more about the second wave? Because I know some people are a little interested in understanding, when was the first wave, and how do we define the first wave versus the second wave?
Yeah. So in Austin, if you go on to Austin or Travis County public health website or city website, you can look at the data yourself. And what we track really is the hospitalizations in Austin. It gives us the most reliable indication of how quickly a disease is spreading. And in Austin, we didn't really see what you would consider a wave. We didn't see cases come up and then go away, right? What we saw was sort of this thing started spreading. We slowed the spread by going into the stay home, work safe order. And then, but it never really started to go away. And then we opened things up. And so in Austin, you don't see a wave that comes and then goes. You see a wave that sort of comes and has sort of, where now we have persistent community transmission of the virus. And so the idea of the second wave is a bit of a misnomer. And I know I just said a second wave, but what we're concerned might happen and what we're worried about and planning for is that this first kind of rise, we're concerned that we're going to see a second, more alarming increase in COVID transmission, in hospitalizations, and in deaths that lead to just a much more critical situation in our healthcare system.
And have we peaked? And if not, when might the peak come?
We haven't really peaked, I would say. And in order for there to be a peak, people are always talking about flattening the curve. You got to decide what you're tracking. Are you looking at cases? Are you looking at hospitalizations? Are you looking at deaths? But these things sort of go hand in hand. And, as I just explained, in Austin, things started climbing, but they never started receding, right? We didn't wait until we got to the point where there was no more disease to open things up. We waited until things had sort of slowed, right? The cases were no longer skyrocketing, but there was still disease in the community. And so, when you talk about something peaking, usually you're thinking about something that rises and then falls, right? But things never fell in Austin. And so, we have not peaked in the sense that it never went away. And what might happen in the coming months is we may see more of a rise in cases and hospitalizations and deaths before we see things going away.
And you kind of just touched on this, but I guess a good question would be, what does peak actually mean? I mean, is it just the standard definition of what we all understand as a peak, or is it kind of different when we're talking about these kind of cases?
Yeah, the idea of a peak is, I think, what a lot of people think intuitively. It's like a mountain or a hill, right? Something goes up and then it comes down. And in some places where around the world, in some cities where there was very fast transmission, and then the cities intervened, with social distancing measures and other measures, and they held on to those measures for a long time. Places like New York and Wuhan, we really did see very, very large increases in pandemic transmission, much, much more rapid, to much more alarming extent than we ever saw in Austin. And then those measures really did lead the virus to start to slow and cases to decline. And so in those cases, in those cities, if you look at their data, you really do see kind of a peak that starts to subside. In other places where, like Austin, other cities where measures were taken really very early on, and then relaxed, what we saw was that the virus slowed, but never, fully went away. And so we don't see this sort of true peak structure that you see in other places where the pandemic kind of grew more explosively before strict measures were put in place. And really these what we call epidemic curves, they can take any shape you can imagine, right? You can imagine, you slow spread and then you relax things and then you get a second summit, a second peak. You kind of hold things in check. You can kind of have a plateau, like almost any sort of geological structure can appear depending on the measures that are taken, how long we hold on to those measures, how much people adhere to those measures, right? And in general, the more we do to slow transmission, the more quickly the virus will recede in our communities. And the more we allow the disease to spread, the faster the rise will be of the epidemics in our communities.
Right. Whenever the peak does hit, what are the risks that still exist post-peak?
Yeah, I think that there's a lot of different ways that an outbreak or an epidemic can peak, right? An epidemic can peak if you don't do anything. If we just had let COVID spread, first of all, it would have been catastrophic, right? We would have had many more people hospitalized than our hospitals could have cared for. We would have seen lots of people dying. But if you really allow an epidemic to just run its course without intervening, then epidemics on their own will eventually peak. They will, and for viruses that immunize people. So, for viruses where after you're infected, you're no longer susceptible. So if you let a virus just run without any mitigation, then eventually, once enough people become immunized because they've been infected, then the virus will slow down and it will eventually stop spreading. And this is the concept known as herd immunity. Once a sufficient number of people have been immunized, have been infected, there's no longer enough susceptible people around for the virus to keep spreading. So in that situation, if you really allow a virus to kind of just run its course, then a peak will happen. And after that peak, it will just not be spreading as more, and the risk will be lower in the community that you'll become exposed because there just won't be as many people infected around. However, epidemics and outbreaks can also peak because of intervention measures, right? So if in a city like New York, which really had a lot of virus, a lot of disease, and then a very strict stay home measure, very strict sheltering in place order, it peaked and then it started subsiding. Well, the population hasn't yet reached the point where there's a lot of immunity built up in the community. So if measures are relaxed, or if they're relaxed here in Austin, then we still sort of have the same risk on the ground, right? The virus is still spreading. Most people are completely susceptible, not immunized, right? Because they haven't been infected. And so in a sense, nothing has changed. And so we have to continue to figure out ways to prevent transmission and to protect ourselves, other than going back into a stay home order, right? So how do we do that? We can do things like wearing, really kind of religiously wearing face coverings when we go out in public. There's growing amount of evidence that by covering your mouth and your nose, you can protect yourself from being infected, but really importantly, if you happen to be infected but not know you're infected, you can prevent yourself from spreading disease to others. Keeping your distance when you're out in public. If you are even feel a little bit sick, you wake up with a mild fever, you have a cough, err on the side of caution and stay home, and actually even stay away from other members of your household. So, the risk is really still the same as it was back in March, because this virus still spreads just as fast as it did when it was first introduced into Austin and into communities around the United States. It can still spread silently, right? This is something that we really understand well now, that people who are infected are contagious before they feel symptoms in many cases. And so you could feel perfectly fine, go out and about your usual daily activities, and actually be infectious and potentially spreading disease to others. Or you can bump into someone who looks perfectly fine and not realize that they are actually infected. And so because it spreads quickly, because it spreads silently, if you may be past a small peak because you've intervened, but that doesn't mean you're past the risk.
Mm-hmm. Mm-hmm. Right. And you kind of mentioned this at the beginning, this talk of flattening the curve. Remind us what that means, and, let us know, have we done it? It sounds to me like we haven't, but just kind of, can you give us a little more understanding of flattening the curve?
Sure. So, I just mentioned a minute ago, like what happens if you just let an epidemic run its course? You don't do anything, right? If you don't do anything and you just, if we had allowed COVID-19 to just spread unmitigated in Austin, we would have seen a very large wave of transmission that eventually sort of peaked. And along the way, a lot of people would have gotten very sick and died. So that is what the curve looks like unflattened. And you may have seen images of unflattened curves. And so flattening the curve is the idea that if we take measures that slow transmission, whether they are really strict stay home measures or us taking precautions to prevent transmission when we're out in public and staying home if we're not well, then the virus will spread more slowly than it would if we didn't take those measures. And what happens to an epidemic is it rises more slowly and it peaks later. And at the peak number of infections and hospitalizations and deaths, there's just not as many. And so you go from what would have been a curve that shot up very steeply and peaked very highly to a curve that grows more slowly. It doesn't reach its peak until later, and that peak is lower. And you may end up with the same number of people infected, or close to the same number of people infected or hospitalized or dying in the end. Hopefully not quite as many, but there is a benefit to buying yourself time, right? The more time we have before we hit that peak, the more time we have to take measures that might even slow the spread more, to ensure we're protecting our most vulnerable populations, to ramp up testing and tracing and isolation that help us to contain clusters when they occur. And the other benefit of kind of flattening the peak is that we may be able to flatten it enough that we never have too many cases requiring hospital care. We never exceed the capacity of our healthcare system. So flattening the peak buys us time, it buys us capacity, and it may ultimately save lives.
Right. Your group has new research out about the timing and impact of implementing social distancing. What does this new research show?
So this is a paper that's just coming out in Emerging Infectious Diseases. And in this study, we collected data from 58 different cities in China that experienced small outbreaks, small epidemics in January, February, sort of just as the pandemic was emerging out of Wuhan to cities around the world. And what we looked at in each of these 58 cities was how many days was there between the first detected case in the city and the first social distancing measure. And many of these cities very rapidly implemented strict measures. They closed restaurants, they closed schools, they told people to stay home. So how many days between the first case in the city and the enactment of those kinds of measures? So that was the first thing we looked at. And the second thing we looked at was how many days between those first measures and the city successfully bringing the epidemic under control. and the way we measure that is, how many days until the virus has the reproduction number of the virus is below 1. So once you get to that point, it means that the virus will just the peak will decline, right? We will see the peaks go away. And so and what we found is what we asked is, was there a relationship between how long it took them to intervene and how long they had to battle the virus until they finally got to the point where the epidemic peaked? And we found that for every day that a city delayed the enacting their first intervention, they had to battle the virus for 2.5 more days.
Yeah.
So, translating that to, perhaps something in the United States, if we are able to accelerate interventions by a week, that might mean that we can shorten the time that we're in a strict measure by 2.5 weeks. So it really just shows that the timing of when we take action can really make a difference in terms of how long we have to enact costly measures, things that are economically or socially negative. And it also might just reduce the number of people that end up getting infected and dying from the virus.
Right. So it sounds like you're kind of giving a specific recommendation, for what cities and other entities should take from this research, kind of start earlier, as I'm guessing would be a recommendation you'd give.
Yeah, that is a recommendation, but keep in mind that some of these measures are costly, and so we're not saying that we should just lock down today and err on the side of like really early recommendations, right? But we're saying that if the situation is changing and you see increasing risk, really things have to change. Either individuals have to adhere better to the measures, or there have to be stricter measures, and you need to do that sooner rather than later in order to mitigate that increasing risk. And what we're really that's one study looking at data from China, but what we've been working on really on a daily basis with the city of Austin, Travis County, the hospitals is really thinking about how when exactly should we implement stricter measures, or should we relax measures so that we can ensure that we're managing the risk in our community without going overboard, without spending unnecessary time under really restrictive measures.
Right. I wanted to ask a question now from Facebook, because you kind of had spoken about this earlier. Um, it says, has any new data been introduced that gives us a definite answer as to whether or not durable immunity that would allow for herd immunity to actually develop truly exists? There have been concerns of reinfection still happening and worsening.
Yeah. So that's an excellent question, and it is something that we do not know definitively. However, I would say that given what we understand about coronaviruses, about other viruses, there's sort of a tentative consensus that there would probably be at least short-term partial immunity following infection that would, to some extent, mitigate transmission once a substantial number of people were infected. So the answer is, like, we don't know definitively. Most experts agree that there will probably be some degree of herd immunity as the number of cases builds up in a city.
Okay. And has there been a difference in cases, spread or hospitalization since Texas started reopening some businesses and loosening stay-at-home rules? I mean, are you seeing any big changes in that?
We're looking really in Austin most closely, and so I can speak to sort of the data from Austin. And what it's the data are very what we call noisy. If you look from day to day, cases jump, cases fall, cases jump, cases fall. Same thing with hospitalizations. What we're not seeing is a decline, right? We're definitely not seeing a decline in cases and a decline in hospitalizations, right? We may be seeing a slow upward trend. The thing is that it takes a few weeks. Suppose that on May 1st, when orders were relaxed, suppose that on that day people changed their behavior in a way that increased the rate of transmission in our community by a little bit, or maybe by a lot. It will take a little while for us to really see that strongly in the data, right? If transmission starts to increase over a few weeks, the people that got infected over those few weeks, a few of them may end up in the hospital or dying, but they won't end up in the hospital for another 10 days. And if they die, unfortunately, they won't die for another 3 or 4 weeks. And then, so we don't see alarming upward trends in the data yet, but that doesn't mean that it's not spreading more quickly. And we may not see that still in the data for a couple more weeks. So we know the risk is not subsiding. How much the risk is increasing, how quickly it's spreading, the jury is still out, but we will be able to know more within a few weeks.
Dr. Mark Escott, the health authority here in Austin, has recently said that there's been an upward trend that he's starting to see in terms of cases and hospitalizations. Earlier this week, we had our largest day over day change with the number of cases. I'm wondering, has your research been have you been monitoring that alongside the city and kind of seeing an upward trend yourself?
Yeah, so I am looking at the same data that the city is providing, and the city is doing an amazing job of making the data available not just to researchers, but to the public. They now have two dashboards that provide a lot of the key indicators that we're all looking at: the cases, the hospitalizations, hospital admissions, deaths, and we are looking at all of those alongside the city. Yes, everything Dr. Escott has reported is certainly, you can see it for yourself on the dashboard. What we look at most closely, as researchers that are trying to get really reliable estimates for how fast the virus is spreading. And the reason we want those estimates is because we want to be able to provide kind of really data-driven guidance as to, what are the risks? Are they increasing? When should we, change measures? The data that we track most closely has been made available on this second dashboard the city has just put online. It's called Key Indicators for Staging. And the data are the daily number of hospital admissions for COVID-19 across all
Right.
hospital systems in the Austin Round Rock area. And we don't look specifically at how many are today, but what we do is we actually look at a 7-day rolling average. So what is the average number of new daily hospital admissions over the last 7 days? And that helps us sort of what we call smooth, so we don't see these ups and downs and like jump to conclusions, right? Because it may, like I would say 2 days ago, we saw the highest number of daily admissions ever in Austin for COVID-19, but the day before it was a very low number. And so back to the question of,
Right.
are we seeing an increasing trend? The answer is maybe slightly, but I think we will, what we're seeing in the case data, it will take a week or two for the increase in cases to end up translating into an increase in hospitalizations.
Yeah.
And the reason we look at hospitalizations most closely as opposed to the case data is that the case data is really, it's great. I mean, it really tells us what's happening on the ground. However, because we're changing the number of people that are tested, we're changing which populations we're offering testing in, and this is true all over the country. Sometimes if you see a jump in cases, it could be due to an increase in testing effort, or a decrease could be because you're testing in a community that just hasn't seen much of virus yet. And so we find that the hospitalization data give us the most reliable indication of how quickly the virus is spreading in the community. However, it's lagged by a couple of weeks from when that transmission events actually happen.
Right. Okay. And given the current path of COVID-19 cases and the spread, where do you see Central Texas headed? Obviously you talked about that second wave and now you're talking about hospitalization. So where do you see us headed right now?
Yeah, I think that it's a big unknown, right? And the thing that we understand a lot about how this virus spreads, but what we don't have a crystal ball for is the choices people are going to make, what their behavior is going to look like in the coming weeks, and policies that might come down the pike, either from the city or the state or the federal government. And so the way this virus is going to spread, how quickly it's going to spread, and who's going to be at risk is absolutely going to depend on the decisions we make on a daily basis, right? If we are, as we go, as things have opened up, if we continue to be cautious when we go out in public, and things we were talking about earlier, cover our faces and keep our distance, and stay home when sick, the extent to which we as individuals do those things, we can actually prevent the virus, the pandemic, from spreading quickly. If people get more relaxed, if people are taking more risks, then the virus will spread more quickly. And so that, in one scenario, we could see a very large wave of, occur over the summer, maybe peak in the late summer, or even in the fall. In another scenario where people really are being cautious, we might not see a tremendous wave, a second pandemic that threatens our healthcare system. So it really depends on, our behavior in the coming weeks and the coming months.
I mean, and that makes me wonder, what would you say to those that are kind of treating this as like, with a lot of loosening of restrictions at the state level? I think a lot of people have been kind of going out into the community in droves. We're seeing larger groups of people. Mayor Adler had touched on, he had some videos from bars where people were really crowded that first Memorial Day weekend, where everyone kind of went out once the restrictions on bars were loosened. So I'm wondering, like, what recommendations and what would you tell people who are feeling a little more loose and a little more relaxed when they go out?
Yeah, I mean, I understand this is very difficult because it's sort of a silent threat, right? We haven't it didn't hit us hard in Austin. So we never, many of us don't know people who ended up in the hospital or died from this virus. So first, the thing to emphasize is, and the reason that didn't happen is because we went into this like unprecedented strict stay home measure that stopped this virus from spreading. But as we look at the data from around the world and places that were slower to take action, we see that this is not a garden variety virus. This is not your typical flu, right? This is a really deadly virus, and it's not just people who are old or have health conditions who end up dying and end up in the hospital for this virus. So the thing to emphasize is, even though we may not have seen it personally at home, I mean, there's a reason that the world has, taken such drastic measures, and it's because it really is a deadly virus. And unfortunately, it spreads so quickly and it spreads silently. And you might be next to someone in a bar who looks perfectly healthy, but they could actually be infected and they could spread disease to you. And even if you're, not someone at high risk, even if you may just have a very mild case, you might end up spreading it to someone that you care a lot about who is high risk, who ends up in the hospital. So unfortunately, it's a really severe virus. It spreads really easily, sometimes silently. And it really is kind of upon us to make decisions to protect not only our own health, but our family's health, our neighbors' health, our community health. So I really encourage people. I mean, yes, things have loosened up and you can go out, you can see your friends, you can have fun, but we really all should be taking steps to limit transmission when we do go out. Keep your distance, wear a face covering, and please don't go out if you or someone in your family has even mild symptoms that we know are associated with this virus.
Right. How do you and the UT COVID-19 Modeling Consortium create these models?
So the models we create and we analyze are really based on, at least in my own team, on about 20 years of being experts in this field. So I've been building models of epidemics, of pandemics, since I'd say 1999, when I was a postdoc and I was working with the CDC. And I got to UT in 2003. And since I've been here at UT, I have worked with public health agencies around the world to help respond to the SARS epidemics, to the 2009 H1N1 influenza pandemic, to the West African Ebola epidemics, and the emergence of Zika in the Western Hemisphere, a couple of years back. And so these models come out of, my own work, a couple of decades of just understanding, of learning, of researching how viruses spread and how human behavior impacts the spread of viruses. And my work rests on centuries of research in epidemiology and infectious disease dynamics. And and the actual tools, the actual mathematics, and the computer science, the engineering that goes into them, in the UT COVID-19 Modeling Consortium, we every day we are meeting on Zoom, working with dozens of researchers, not only from around the world, but from many different disciplines that are bringing different perspectives, different tools, different kinds of expertise that have actually allowed us, not just to build the kinds of models we've been building for the last 20 years, but really to very rapidly innovate so that we can build models that actually look at daily cell phone geolocation traces from millions of people, and use that to inform our estimates for how fast this disease is spreading. So we're using science and information and knowledge that rests on centuries of research, and we're also using very innovative tools that are coming from collaborators across many different disciplines.
Well, I could ask you a dozen more questions about the modeling research, but I also want to make sure we also ask One important question, which I think is something that is on a lot of people's minds. So many people are curious about whether or not school could or should happen in person this fall. Does any of the consortium's modeling work speak to that or forecast what might happen if schools open and how, if possible, to open safely?
Yeah. So yeah, we have certainly done research, not just during the COVID-19 pandemic, but for other threats, looking at how do school contacts that happen in school, how do they impact the transmission of viruses, not only in schools but into the community. And what we know for many different respiratory viruses is that children are often or can easily spread viruses uh, at schools, and then they can bring them home and be kind of sources that propagate virus spread in communities. And so, that's what we know sort of for viruses in general. For COVID, there have been some questions raised regarding how frequently children actually become infected, how infectious children are once they do become infected, and there's still a lot we don't understand, and that's partly because in many countries around the world, the COVID-19 pandemic has happened at times where schools were either already closed or they were closed very quickly to respond to the pandemic. So we don't have much direct data on how quickly the virus will spread in schools once they're opened. Regardless, what our models tell us is that if schools are open and there are not steps taken to reduce the risk of transmission, then the opening of schools can increase the rate of spread in the community at large and can lead to future waves of transmission. But what they also tell us if is, and this is in any context, in any industry, or school or healthcare setting, that if measures are taken to limit the number of contacts that people have per day. So if kids just aren't having as many contacts with other kids, and to limit the risk of transmission when people do come in contact with each other, put desks further apart, come up with some sort of strategies so that kids aren't going to the washroom at the same time or walking into the school or leaving the school at the same time. So if steps can be taken just to simply minimize the number of close encounters between people, and if steps are taken to reduce risks when those close encounters happen, like wear face coverings, and critically also, if we think through how do we ensure the health of our vulnerable populations, children who have underlying conditions, teachers and staff who have underlying conditions, or maybe live in households with people with underlying conditions, anything we can do to especially ensure their health and safety will be critical to opening schools in a safe and effective way.
Right. I'm wondering, how do you personally process the data points, especially when you're charting hospitalizations and deaths, knowing that those are real people who had friends and families? We talk a lot about data, but at the same time, we're talking about people and we're talking about lives. So I'm wondering, can you tell me a little bit about what that's like for you?
Yeah, it's it's very stressful. I have to say, to be honest, I mean, even though I just said earlier, I try not to, as a scientist, look at the day-to-day ups and downs, because I know that that's not a reliable signal, and we have to do this averaging. Every day I kind of wait apprehensively for the daily update. And, I have a little like my stomach sinks when the numbers go up, and, I'm thinking about people, and I have a little bit of relief when I see the numbers go down. And so I think, it's, uh, it's sort of always there in the background. Yeah, and this is actually what motivated me to go into this line of work, and motivates a lot of the work we do today. And I think that, a lot of people in the consortium feel the same way. And there's, a lot of people who have kind of signed up to help and to lead projects. These are people who really didn't know much about epidemiology. They're experts in different fields who, have brought different kinds of tools to the table and said, we'd really like to help. And I think that's what's motivating a lot of people. They want to do whatever they can to bring science and to bring data to the table to help decision makers make whatever decisions they can make to ensure that we're saving as many lives as possible, while also being cognizant of other economic and social costs of different kinds of interventions. And I think it's why we're all trying to work around the clock to do what we can do.
Of course. I do also want to ask, especially given this moment, are you concerned at all about the effect, the spread of the virus might have due to all of these protests happening within the city. Obviously, it's not just here, it's across Texas, across the country. And we're just seeing a lot of people packed together. Yes, many of them are wearing masks, but still, in terms of social distancing, that's not really happening. So I'm wondering, are you at all concerned about that?
Yeah, I'm very concerned. Absolutely. And I mean, the more I see people wearing masks, I feel a little more relieved. The more I see people trying to keep, anytime this virus spreads when people come in close contact with each other, and and there's respiratory particles, and spit or whatever coming out of their mouths. And so the more people are coming in contact with each other, and the less they're actually protecting themselves, the more opportunities there are for transmission, right? And when it's large numbers of people, you run the risk of what we call super spreading events. If you have one infected person who is not wearing a face mask and is shouting loudly, and there's a lot of people around them in close physical proximity, there's a lot of potential risk of exposure. And so I'm really hoping that these don't amplify transmission, but it certainly is increasing the risk in our cities.
Right. And I always just like to end. Is there anything else before we conclude the interview that you'd like to say right now?
No, I guess I would just say that I feel really fortunate to live in Austin and to be a scientist in Austin. I think I have, colleagues around the world and, around the country who do what I do. And I don't think there is any one of them that lives in a city where the policymakers, the city leaders, all of the leaders of the major health systems, and the experts, the scientists, the community leaders are all really working together on almost a daily basis to try to understand the threat, to try to keep tabs on it, and to make policies for the months ahead that are really kind of geared towards, protecting lives, protecting safety, but also thinking about people's, social and economic well-being. So I'm grateful to be here, and I'm grateful to have the city leaders we have.
All right. This has been Now What, a series of live streamed events from KUT in partnership with the University of Texas at Austin and the Dell Medical School, focusing on what comes next as we grapple with what the coronavirus pandemic means for our lives now and down the road. This week, we've been speaking with UT Austin professor Lauren Ancel Meyers, who runs the UT COVID-19 Modeling Consortium that tracks and models the spread of COVID-19. Lauren, thank you so much. I really appreciate you taking the time today.
You're welcome. Stay healthy, stay safe. Bye-bye.
Bye.